warm welcome to this campaign for social science event, which is done in partnership with the University of Exeter. The campaign for social science, of which the University of Exeter is a long-standing and strong supporter, exists to demonstrate how social science improves public policy, society, and all our lives. It highlights the value of applied social science research and advocates for its greater use in decision-making within government. We are incredibly short on time, so I am going to keep my introduction to an absolute bare minimum, but it is a real pleasure to welcome Professor Matt Lobley, who's going to speak first, Dr. Rebecca Weeler, and then finally Christine Malseed, who will be known to many of you, who is a farmer and does so much for FCN, which of course does vital work in this field. So I'm going to hand over to the panellists, who will do 10 minutes each. I will then have a few observations on the back of what they have said, and then we're going to throw it out to the audience for a Q&A, and hoping to wrap up by 8 o'clock when there is going to be drinks and nibbles out in the lobby. So Matt, I think without further ado, if I can hand over to you, and I'll try and keep a tight eye on the time scale, says she, who's very prone to going over, so we'll try and keep it to 10 minutes.
Thank you, Minette. And hi everybody, and welcome to the university for those of you who are visitors. I normally stand up to talk, but I'm going to do this sitting down, try and be cool. I just must make sure I thank our faculty senior management for helping to co-fund this, because we didn't have a budget for this. I'm just going to say a little bit about the CRP, our research centre, for those of you that don't know us. I know some of you do, and some of you are actually members. So the CRP, our Centre for Rural Policy Research, is a grouping of social science researchers in the university. I'm one of the directors. My colleague Harry West over there is the other director. We do kind of what it says on the tin. We do lots of research, we do related teaching, and it's about rural stuff, but actually it's really about field to fork, and so that includes farming, it includes consumers, and it includes that bit in the middle that's often really difficult to work out what's going on sometimes to get information. We do a lot of research on a large number of areas, a lot of stuff on environmental management, and for the last few years it's been my privilege really to lead a programme of research on the health and well-being of farming people who farm. Sometimes we call them farmers, we call them all sorts of... I'm settling on farming people for now. One of these days I'll get a term that I'm quite happy with. And we've done work. We undertook the largest ever survey of farming people in England and Wales a few years ago, funded by RABI. Becca's led a number of these projects for me. She'll talk about some of it, and my colleague over there, Caroline Nye's, done some other stuff, some really good work on the role of livestock markets. It turns out, that thing about trading in livestock, that's just a bit of what goes on there. The social element's really important, and some of you know this clearly. So I'm just going to start off, bearing in mind I've got to stick to time, to say if anyone's interested in finding out more about the CRPR later, come and speak to me or Harry. There's some brochures about our master's programme in food studies. Never let an opportunity to promote that go by. So, look, do we have a crisis in mental health in rural areas and in farming in particular? Well, we'll see over the next hour. But I want to start talking about something that's an analogy to help us get our heads around this. Some of you have heard me say some of this stuff before. Honestly, it's not repetition, it's reinforcement, which is a really important teaching technique, to reinforce these points. So you're all familiar with the thing about icebergs, the bit that sticks up above the water, the bit you see, that's just the tiny bit. There's a huge mass below that you often don't see, and that's what often gets you. We can apply that analogy to mental health and well-being. So if you take, for example, suicide statistics, and there'll be colleagues in this institute who would be critical of what's counted as suicide, who's counted, how things are allocated, but that's the bit that gets measured and gets talked about. And stats change over time, but farming is up there in a league table that nobody wants to be in. Right? And it's not just in this country, it's in many countries across the world. But if you think about it, those people, they took their own lives. For every one person that does that, there's a whole load of people that try and don't succeed. So my wife used to work on the acute psychiatric wards at Wanford House, just over the other side of Exeter. And on a number of occasions, she intervened and cut people down who were trying to hang themselves or choke themselves. Now, I've got no idea what happened to those people. I like to think she bought them a bit of time, a bit of space to help them, get the right treatment and get their lives back on track. So you get all these people that try, don't succeed. You get a load of people that are thinking about it and haven't acted. Then you get a load of people who have a diagnosed mental health condition. And I'm not talking here about kind of psychosis and splits from reality. I'm talking about things that are very common. Depression and anxiety. Loads of people getting treatment for that. Then there's even more people who are suffering from depression and anxiety and haven't acknowledged it to themselves and haven't reached out to health professionals. And there's all sorts of good reasons why they might not, particularly if you're a farmer, particularly if you have a shotgun licence. So there's all those people. Then there's a whole load more people who just feel really and not very good about what they're doing. They're spending 80 hours a week working really hard in all conditions for not very much money, and then they're castigated for causing climate change. There are people in this university who will say agriculture is the biggest threat to biodiversity on the planet. I say, you know what? It's also the biggest solution. So there's a lot of pressure always on our farming people, because what we do, we always ask more from farmers. So once upon a time it was enough to say, well, you go and do some farming for me so I don't have to go out and hunt and I don't have to till the land and I can go and, make these newfangled things we've just invented called wheels. I'm going to focus on wheels, you do the farming bit. And then we've added, actually it needs to be safe and nutritious. I don't want to consume some fungal spores that's going to send me off on a really weird trip or something like that. I want to know it's nutritious. I want to know where it's come from. I want to know that you've not damaged the environment when you've produced it, and in fact you've enhanced the environment. And I want to know that you're helping us get to net zero, and I want this and I want that, and all of these things we keep asking. And then of course it's a highly regulated sector. It would be. We all rely on farmers 3 times a day, 4 times if you include second breakfast. So, we're putting this stuff in our bodies every day. So it is regulated. But sometimes those regulations can be difficult, particularly if you are experiencing anxiety and depression, and an inspector rocks up on your door who has the ability to sanction you and cause real problems for your business. So there are all these pressures and strains on farming people. And then often we would say, Becca and I and Caroline, that in modern society, particularly in this society here, farmers are actually socially and culturally isolated. They may be physically isolated, working long hours on their own, nobody to talk to. But, farmers, and I know there's some here in this room, are a socially and culturally distinct group. The gap between farming people and people who don't farm is enormous. It's not a rural-urban thing, okay? It's a farming, non-farming thing. Non-farming people don't understand you, and to be honest, you might not necessarily always understand non-farming people. It's a two-way thing. But that isolation compounds all of these problems, all of these feelings that nobody wants you, nobody supports you, everybody's blaming you. And if that's the way you feel, and you're working 80 hours a week for, 12 grand a year, it's pretty difficult to be resilient in the face of all that. So we know that there are significant problems with the mental health of farming people, and what we need to do is encourage appropriate interventions. And that means we need to be talking to central government about funding, we need to be talking to the NHS, and Becca and I and Devon are talking to some of the local NHS about some of these issues. We need to be engaging with the brilliant work that the farming help charities do to help so many people in the farming communities, and all of the agricultural stakeholder organisations. And of course I can't sit here and not mention the NFU in all of that. So, a lot of this comes down to farming people helping other farming people, breaking down the barriers between farming people and non-farming people, getting each, I'm going to use the word side, I hate using the side word, but I can't think of another word, to understand each other, understand where people are coming from and support each other. So I always think, as humans, largely. There were some exceptions. We're quite good at sympathising with each other and empathising. So I care about people's health and well-being because you're fellow human beings. But also, to be totally kind of selfish, there is a utilitarian motive here. We need a fit and healthy farming population to deliver sustainable agriculture. All right? And it's only going to be sustainable if it's environmentally sustainable, socially sustainable, and economically sustainable. If you don't get all three, it's not sustainable. And the health and well-being of farming people is a big part of that. So my last point is, I carry around in my head a Venn diagram model. Remember Venn diagrams from when we did maths at school? I have two Venn diagrams I use in my work, and it makes me wish I'd paid more attention at school in maths. When I say more attention, just attention would have helped. But anyway, you've got these three interlocking circles. And so I have one that's labelled mental health, one that's labelled physical health, and one that's labelled business health. And in the middle, they all intersect. And when it's going well, they're all mutually supportive. When things are going not so well, they can all negatively impact each other. So lots of people, for example, carry around physical injuries, chronic pain. You know, my hands don't work so well anymore due to arthritis. I've been known to drop things when I hadn't intended to drop them, and sometimes, you know, the pain just it drags you down. So it can impact on your mental well-being. That can then impact on the performance of the business because you're losing sleep or you're self-medicating or doing a whole range of other things. And so these things are all interconnected. So from a purely selfish point of view, we want a farming sector that's going to deliver all these amazing things, food for us, the environment, help us get towards net zero, provide a meaningful living for people who farm. And so there are some really big issues here that we need to address in order to be able to deliver that. I'm going to end it there. I could quite honestly talk all night on this, but I'm not going to. So I will leave it there and hand over to Becca.
Matt, thank you so much. I don't think we should underestimate what a huge treat it is to hear from the experts at Exeter University. I mean, you are, in my travels around the country, Exeter probably gets referred to, I think, more than any other university for its work in mental health. And I think it's needed more than it's ever been. So it really is a huge treat. And now we're going to move on to Dr. Rebecca Weeler, Senior Research Fellow at the Centre for Rural Policy at this university. Becca.
Thanks, Matt. So yeah, thank you for everyone for being here. It's nice to see some familiar faces in the room as well. I'm going to hopefully build on what Matt says. I'm not going to focus so much on the kind of issues and stresses around farming, because I think Matt's done that really nicely. And I want to focus a bit more on what we feel are some of the potential kind of solutions or ways forward to tackle it. I will just kind of, before we do that though, just start with some of the kind of headline findings, if you like, from the survey that Matt mentioned we did with our OBI. Because I think it does just underscore that whether or not you can call it a crisis, I don't know what's the definition of a crisis, but there are certainly some concerning levels of poor mental health within the agricultural community. So essentially that survey showed that 36% of farming people we surveyed were either possibly or probably depressed, and 18% were suffering from either moderate or extreme anxiety. I think it was something like 49% were suffering from anxiety of some sort. And on top of that, 52%, for example, were suffering from moderate or extreme levels of pain. And as Matt says, that's all kind of intertwined together. So, I mean, whether or not that's better or worse than other occupations, I mean, we feel it probably is worse, but that's kind of beside the point, because that's a lot of people who are struggling and in need of support. So I thought I'd kind of start by kind of thinking about, we've got a new government, and thinking about the kind of the brief that we got for this and what the policy approach should be. And I think the first step in my mind, and perhaps the most important one, is actually just to acknowledge that there is different needs within the rural community compared to the urban. Not necessarily greater, but different. People have different lives, different experiences, and different occupations. So obviously our work has focused predominantly on farming, But actually, some of the issues are indeed occupational, as Matt's talked about, and some are actually just related to the fact that they're rural and it can be difficult to get to a doctor because the transport connections are bad, or the rural broadband is not as good as it could be, and things like that. So it kind of, my kind of first step in terms of policy would be to think about that in the kind of broader rural context, to revisit some of the recommendations from the inquiry into rural mental health, which was done a couple of years ago and which we submitted evidence to. And that cross-parliamentary inquiry came up with a set of recommendations, which the government at the time, I would say the response was disappointing, shall we say. But I think there was a lot of valuable stuff in there that could be revisited. That includes kind of ensuring cross-departmental working, so kind of joining up the departments of health with DEFRA, along with kind of other departments like Department of Transport and so on, to kind of tackle that rural context as well as just the agricultural context. And part of that as well should be thinking about actually who designs support services, health services. And actually it needs to be those intended beneficiaries who are involved in that process and who can have a say in what that might look like. And I think there is already some onus within the healthcare system on kind of local delivery services, which is great, but actually that needs to be, there needs to be some level of consistency nationally, that, you know, there are some kind of guidelines or support or funding to enable that, because I don't think that all rural areas are necessarily being served to the same level, perhaps. So moving on, I think the other thing I wanted to emphasise was the importance of multidimensional support. And that ties very much in with what Matt was saying about, you know, the multiple stresses. There's not just one thing that's underlying the kind of stress, anxiety and depression within the agricultural community. There's lots of things, and that needs a multi-pronged approach. In terms of stresses, I think, you know, anything we can do to reduce the levels of stress, and often that is to do with the business, with financial pressures, the long working hours that farmers work. So any kind of business support. So recently there's been the Future Farm Resilience Fund, which Christine's been very involved with and will be able to talk about much more than me. And that's provided kind of the business support to farmers to help try and ease some of those worries. That is coming to an end next year in March, but I think thinking beyond that in terms of policy support for that kind of business support is really important. There are also other kind of more informal approaches to support that I think are important. So thinking about kind of community initiatives that help foster positive well-being before, to try and stop these issues becoming such an issue in the first place, if that makes sense. So I'm thinking here about providing more social opportunities. It can be really difficult for farmers to get away from the farm and engage with that, but the more that we can kind of support that on a local basis, the better. So there are really great examples of volunteers and charities and individual farmers setting up kind of social groups, whether that be kind of regular breakfasts, or there are some good examples locally around here of kind of groups for retired farmers. And all that can only be a good thing. But again, that's not necessarily available everywhere. It's kind of very ad hoc. So the more that those kind of things can be supported, the better. And then the other thing I'd say around support is that thinking about the kind of formal healthcare support needs to be tailored to farmers and agricultural families in particular. And I say that particularly because we hear again and again in our research about the importance of farmers actually feeling understood by the healthcare professional, for example, that they're talking about. Maybe it's not unique. I mean, it's debatable. There are other occupations which have similar contexts, but there are certainly particular things that farmers face that may not be readily understood by other occupations. The long working hours, the kind of intertwined nature of the kind of home and business life, and actually just the importance of farming to their identity, and as to kind of how important that is to keep that family farm running, and the pressures that places on people. So I think we've talked before about the need to perhaps train rural GPs, for example, to make them more aware of those kind of stresses, so that they can be a little bit more sensitive to the needs of farmers and farming families. And as Matt said, we're kind of working with locally with NHS Talkworks to try and help them adapt their service a little bit better to suit the needs of farmers. And that's just one example of where I think this can be done. Conscious of time, I'm probably talking more than I planned.
You are very close to the end.
Okay. I'll skip very briefly over this then, but just say in terms of tailoring, I think there's also kind of particular, farmers aren't all one homogenous group. One farmer is not the same as another farmer, just like that goes for everyone. But you can say, there are different demographic groups within farmers who might have slightly different needs. Thinking particularly about young women who came out in our research as particularly suffering from anxiety and depression, sometimes often forgotten about, because I'm afraid many people do still think of farming as a kind of male-dominated industry. It probably is in many ways still a male-dominated industry, but the women are behind that, and not just as kind of farmers' wives or daughters, but also as primary farmers themselves. But they're juggling lots of different things. So their kind of help-seeking needs and the support they might need might be different to someone else. And the same goes for other groups. The same goes for young people and children. And I think we kind of actually lack research in that area about what young people and children on farms, how they experience mental health issues, and how we can best support them and intervene at an early stage to stop these problems escalating. I will stop there with the final thing of saying it's not just policy, it's not just government, there's a role for everyone. We've talked before, and some of you may have heard us say before, about some of it comes from within, from having a cultural change within farming itself, which says it's okay to prioritise well-being, it's okay to take time away from the farm, and that's really important. And there's also a role in wider society in terms of kind of improving that connection between farmers and non-farmers, so that they do feel more appreciated and valued.
Thank you very much indeed. I don't know about you, but for me, hearing from two experts, understanding this issue, I've been in a lot of conversations and a lot of government meetings, and it's very rare to hear experts talking about it, and I can tell you it's extremely refreshing to hear it. So we've heard from our experts. We're now going to hear from our third expert, who's going to talk from the practitioner's point as well. Christine, a very, very warm welcome. Thank you.
Thank you. Hello to everybody. I'll just give a potted history of what I've done and with my family and where we are now, and some of the hiccups we've had along the way. Can everybody hear me? Mm-hmm. Yeah. So my husband and I were from both, he was the son of a vet, I was the son of a fashion buyer in Regent Street in London, and decided I wanted to go farming, much to his horror, and came to Seal Hayne, where I met Mike, who, as I said, the son of a vet. He went share farming on Dartmoor while I finished my degree, and then we were very fortunate in getting a tenancy with a duchy on Dartmoor, and then we extended that tenancy with another area of land with the duchy and also National Trust. So we ended up farming just over 1,000 acres, a lot of it up high moorland. So we had suckler cows, sheep, moorland sheep, and we, from the first get-go, we decided to have 70 Christmas turkeys because Mike had worked on a farm and there was good cash flow. Anyway, that quickly turned the next year to 300, and then over the years we built that up, and now we're doing mainly organic and some free range for retail, and the rest of the organic ones are all wholesale now. And we're doing about 7,000 turkeys. And along the road we had I worked as a rep for Dalgety, which was great, and then I stopped and had babies and did farmhouse bed and breakfast with the first and the second girl and evening meal. Tried to get pregnant with number 3 and had a double, so no more rooms, so that was fine. Had the twins and very confident that I coped with the 2 first singles and blah, blah, blah. And then 3 months into having the boys, I knew something was completely wrong, and it turned out I had something called depression, which I'd never heard of, and I had quite severe postnatal depression. And luckily Michael's family were very supportive and got a nanny in, and I was actually hospitalised when they were 3 months old for another 3 months, and overcame that gradually, and carried on farming. And as I say, we were building up the turkeys over the years. We were entering environmental schemes. So there was a lot going on. And also bearing in mind we were tenants, we were trying to look to the future and knew that when we started making some excess profits, we were looking at purchasing a house in the village. So we were, future-proofing as well. And yeah, everything was swimming. And then I had another blip, another hospitalisation, and I dealt with. When you're allocated I'm with the credit and mental health team, and you're allocated a psychiatrist there. There's just the one psychiatrist, and then you're allocated a community psychiatric nurse. Their names change, but that's basically your support worker. And over the years, I've had 1 or 2, and when I was signed off, they always say, "Oh, I've learnt so much," and I'm saying, well, you should know this, because they had no understanding of rural issues, of when I said there's a TB test coming, they couldn't understand why I was really agitated, and just other things like turkey time, collecting the money in from various companies, didn't happen on time, and affecting, then you have the turkey feed bill to pay. So with all these issues going on, and also we were known. We didn't have this generational history behind us, which I think in some ways was a positive for our point of view. We were known as the college farmers locally, because we try new things, and if they didn't work, well, we didn't do it, But a lot of neighbouring young people said, "Oh, we couldn't do that because Mum and Dad would never allow that." So we realised we had a lot more freedom than a lot of other traditional farming families, Sorry, I just lost my track. Yeah, so the girls, one's gone off to be management consultant, and another daughter did a degree at Harper Adams and is milking cows once a day and adding value with ice cream. And then a son's become a gamekeeper up in Scotland, and at 27 he became head keeper of a 12,000 acre estate of grouse and deer. So we've all encouraged them to follow their own interests and be take risks as well. And John, he was a 6'7", a sheep shearer, went off to New Zealand, came back, and then we put him, he wanted to go shearing in November, so we then allocated him the turkey enterprise, so he couldn't go. And it was a good choice we made, because sadly, just nearly 3 years ago, in the space of a week, it manifested itself. My husband went through a crisis. And we'd gone down with TB after having the cull and not really expecting to go down, and suddenly we went down. The sheepdog got put down, and Natural England told us to remove all our sheep on we have 2 flocks on 2 holdings, and the Natural England said, "Oh, we want you to remove the sheep flock here," which includes Wisman's Wood, which is an SSSI. We feel they're eating the oak forest, and I said, well, the maps don't show any degradation, but Natural England, they know best. And I said, well, where are we supposed to put them? And they said, oh, take them to your other farm. And I said, well, actually, we have another flock of sheep there. And I remember a farmer's wife talking to Natural England, saying, oh, well, I haven't got a kitchen cupboard big enough to take these cows off for the winter and then bring them out again. And, I was trying to explain, and Michael was very agitated as to what the hell was going to happen. And so it's like Matt and Becca have been saying, it's a multitude of things, but it happens so quickly with Michael. And he reached out and was talking to local farmers, he was talking to the NFU as well, and I was having to follow up each conversation saying, yes, I know he's not right. And And basically, he rang 999 at 6 in the morning saying he was suicidal, and they said, how much? And he said 110%. The ambulance didn't arrive till 4 in the afternoon. You know, and I just think, and we had 2.5 days of inquest where it just highlighted the failings, and it's sad because it was just a catalogue of failings of ambulance, hospital not giving him right obs and just leaving him for 3 hours without looking at him, and in the end he walked out, and then the police not, when we passed on his location from his phone, not carrying on and looking at that, so he wasn't found till the next day. So and the inquest sort of highlighted, and the coroner was really good in that he allowed me to ask questions to bring points back, really, to say, well, did you follow procedure? Well, no, but. And I said, no, so you haven't followed procedure. And it's just one of those things. And we don't, you know, you could say, well, Michael might have been successful at another time. We don't know. But it was just the sheer speed of everything that happened. And because it was COVID, I couldn't go in the ambulance, and I wasn't allowed to attend the hospital. And I'm sure if I was there, I think outcomes would be different, but who knows going forward. So I've had a lot of experience dealing also with another thing I wanted to highlight was the coroner, and for 2.5 years I was the one ringing the coroner to find out information, not them telling me. And to the extent the last time I phoned, they said, oh yes, you're going to have a 2-day inquest. So I made a point of a private meeting with the coroner before the inquest to say, can I just discuss my concerns? I don't want anybody else going through this experience that I've had. And he said, well, first of all, we'll have it in the courtroom and it will be recorded. And I just said, woo, this is what I'm talking about. You're not preparing, you know. Anyway, I was given my chance, and he did record it. And he said, I'm going to replay this at our meeting to learn from it. So and again, all through the coroner's inquest, I was just saying, I just don't want this to happen. And to be fair, the process for mental health patients when they come in has now been changed. It got changed the Monday after Michael's death. So things are changing. But even now, when I'm on a certain level of antidepressants, and I said, oh, I wouldn't mind a checkup or a follow-up. Oh no, I was told the psychiatrist isn't seeing people at the moment. Oh right, okay. And if you have a crisis, you ring supposedly the crisis line. They don't pick up. And this is where I'm afraid FCN come into their own. And and they have been invaluable for me personally and for so many other people. And just helping other farmers, male and female, to encourage them to learn, to have the confidence to ask questions. Just how to talk to somebody when they're suicidal or just down and that sort of thing. And just as a comparison, because of turkeys, I've just had a shoulder replacement and waited 2 years, but my gosh, I could ring up the surgeon or the consultant and get a message through, and they were talking to me every six months as to where I was on the list. And you just think, and I've had a follow-up, which has been amazing, and physio, and yeah, physical health is completely different to mental health. And someone said, this is my personal view, but someone said, the mental health service is in crisis. And I said, no, it's broken down. And I'm sorry, but that's my view. So we need to do something drastically going forward. Thank you.
Christine, my goodness, thank you for sharing that. I mean, between the three of you, I listen to a lot of things. I think what you've all said is incredibly powerful, and something has to be done.